Hello, everybody. I'm Alexander Lee, and I'm a high school researcher working with Dr. James Shea, who's an associate professor at Azusa Pacific University. And I'm here to present to you the real time monitoring of urine output with Internet of Things connected Foley catheters. And here's today's agenda. Background. Urine output is a good indicator if a patient has renal or urinary impairment, and that's important because it's a good indicator of a patient's overall health. And a Foley catheter is a device that's used to collect a patient's urine output. And so nurses usually measure this urine volume. However, this is ineffective because these measurements are only performed once or twice a day. Nurses have a lot of patients to attend to, so they can't spend too much time with each patient. Secondly, these measurements are often inaccurate as they have to be done visually. And to solve this issue, there have been existing electronic measurement devices. One existing Foley catheter electronic measurement device is the Renal Sense Clarity RMS sensor kit, which is based on thermal transfer. However, this isn't a feasible option for most hospitals as it's extremely cost prohibitive, with the console itself costing $5,000 and a single-use Foley catheter bag costing $85. Given that current Foley catheter measurement scales are so expensive, we wanted to create a new scale that's low cost, so that a lot of hospitals would be able to use this. And so our own device, our own IoT Foley catheter scale, costs less than $100 to make. And we made it easy to integrate. That way hospitals won't have to change any of their pre-existing system to use this device. They could just start using it. And so we wanted to use a wireless network because that's already widespread and we don't want to have any wires interfering with a nurse's work. And we wanted to use a network system. That way multiple of these units could be deployed at the same time. Because many doctors and nurses have phones, if not all of them, we wanted to use a mobile applications. That way doctors and nurses could be able to easily access the information or the data from the scale. And so we also made this device easy to use. All you need to do is hang up the scale and then hook the Foley catheter to it. For the IoT Foley catheter scale components, I chose to use a hanging scale. And so when I designed the scale, I didn't want to redesign any of the housing structure, and so there's already a hanging structure, which was great because I didn't need to add anything to it to make it hang. And there's already a strain gauge, which is the weight sensor in it, so I didn't need to add my own to it. However, I did have to take out most of the electronics within it and put in my own electronics. This included the analog to digital converter, which just takes the readings from the scale and converts it, and a CPU. And so this CPU already has Wi-Fi capabilities and it has its own battery. We wanted to have a cloud server that's able to collect all of this data, and the server can send this data to a mobile application, and from there, nurse could just use the mobile application. For the hanging scale itself, we chose to use a commercially available hanging scale, and so it's relatively small. It only measures 94 millimeters by 51 millimeters, and it has a strain gauge load cell within it, which is the weight sensor. And it has a 50 kilogram range with 0.01 kilograms sensitivity, which is great for what we're looking to do. And it's very cheap. It only costs around $10. For the amplifier and ADC, we chose to use the HX711 strain gauge load cell amplifier. And so it's optimized for human weight measurement, which just means it's used in bathroom scales. And its ADC has a 12-bit resolution. And so the HX711 operates at 10 samples per second or 80 samples per second, which is sufficient for what we need. Our device only needs to have about 1 sample per second, so 10 is already great. And it's really cheap, it only costs $1 US. For the CPU and wireless connectivity, we chose to use the M5 Stick C. And that's because it already has the CPU that it uses is the ESP32, and that's good because ESP32 has very high processing power, and it already has built-in Wi-Fi and Bluetooth connectivity, which means I don't need to add any additional electronics to make it have Wi-Fi capabilities. It's very small, measuring 48.2 by 25.5 by 13.7 millimeters, which means that it's able to fit within the hanging scale cavity. And it's has an integrated 120 milliampere hour battery already built in, which is very useful as we don't need to add our own power source. It already has its own, and it's relatively cheap, costing $15. For our Foley catheter, we just chose to use a standard Foley catheter it's commonly used in hospitals and clinics, very widespread, and it's only cost around $15 US. So yeah. For our cloud server and mobile application, we chose to use Blink.io. And that's because we wanted to create a mobile app to display a graph, and Blink.io simplifies the IoT to mobile device integration. Um, there's also data transfer between the cloud server and the IoT device via virtual pins, and there's data, and the mobile app interface has a data display and user control. For our software development program, we chose to use Arduino because it has a great environment and it's already compatible with the components that we chose to use. So it has open source integrated development. It's an open source integrated development environment, and it already has a large quantity of existing library and sample code. It's compatible with ESP32 and M560, and it's also compatible with Blink, which is all the components that we chose to use. For the IoT Foley catheter integration, what I first did was that I removed the main board and the LCD that was inside the scale. And then after that, I took the strain gauge and I connected it to the HX711. From there, I connected the HX711 to the M5 Stick C. Afterwards, I had to develop the weight measurement software along with developing the Blink software. After that, I had to configure the Blink system and I configured the Blink mobile app. For the IoT Foley catheter operation, all you need to do is you first hang the Foley catheter on an IoT scale unit and tear the empty Foley catheter. That way the weight's zeroed out and the readings will be accurate. From there, inject the simulated urine into the Foley catheter at a constant rate, and the IoT scale will actually measure that and transmit the data to the Blink system. You can then monitor the urine output on the mobile application. For the urine output mobile phone integration, here's a screenshot of the urine monitoring mobile app showing 80 milliliter water output into the Foley catheter in over the span of 30 seconds. And so you may notice that the slope isn't smooth. It's actually jagged. And so the data itself is smooth, but it's jagged because our device has a 5 milliliter resolution at a 1 second interval, causing the jaggedy slope. For our future work, we would like to create a mobile application that's able to calculate urine output rate over time in milliliters per hour. We would also like to have our mobile application calculate the delta change in urine output rate over time. And we would also want to create a feature where if the urine drops below a preset level, it provides an alert, or an alert is provided. And we would also like to have our external battery pack run for a longer period of time. Ideally, we will want this to be, we will want the battery to last 24 hours. And we would also like to correct the temperature drift. So in most clinical settings, there is no temperature drift because the temperature is maintained very constant. However, in a non-clinical setting, or if there's the temperature isn't controlled, there can be a drift in the readings. Obviously, we want to fix that. So we would have to do that by using a compensating strain gauge to correct any potential drift. So, in conclusion, current methods of measuring the urine output volume are either ineffective for hospitals or they're too cost prohibitive to be implemented inside a hospital. And so this research aims to provide an inexpensive scale that's able to transmit the information to a mobile application. And so then the data can be sent through the cloud. And so our initial system has already been built and demonstrated. And our future works includes creating more features within the application. Thank you all for listening.